Sat Sri Akal Ji. Hello, my name is Dr. Jasmeet Singh and I'm a GP working within NHS Greater Glasgow and Clyde. I'm here to talk to you about the COVID-19 vaccine. I have now had both doses of the vaccine and feel completely fine. For me, taking the vaccine is a form of seva as we are helping the wider Sangat to stamp out this awful virus. This vaccine is completely voluntary. No one is being forced to have it. However, getting the vaccine is the best way to protect yourself and others from COVID-19. Even though the vaccine was developed quickly, rigorous testing was still required. NHS Scotland will only use a vaccine if it meets the required standards of both safety and effectiveness. All medicines, including vaccines, are tested for safety and effectiveness before they are allowed to be used. The safety of the vaccines continues to be checked while they are being used. The COVID-19 vaccine was able to be developed quickly for a number of reasons. For example, funding was no obstacle. Thousands of scientists contributed to the effort. Tens of thousands of people signed up rapidly to participate in COVID-19 trials. It normally takes much longer to recruit people, but because so many people had had COVID-19 in the population, scientists were able to observe the effectiveness of the vaccine more quickly than with rarer diseases. Finally, pharmaceutical companies started investing in manufacturing early on, so there was no delay between completion of testing and rolling out of the actual vaccine. As with most medicines and vaccines, some people may experience mild side effects after the COVID-19 vaccine, such as fever or muscle pain. These usually last for a day or two. Serious side effects are extremely rare. There are very few people who actually cannot get the coronavirus vaccine. There is no evidence to suggest that COVID-19 vaccines will affect fertility. You do not need to avoid pregnancy after receiving the COVID-19 vaccination. The vaccine is not routinely recommended if you are pregnant, as it has not been tested on pregnant women. However, if you have a high risk of exposure to coronavirus or have underlying conditions that place you at very high risk of serious complications of coronavirus, you should discuss the risks and benefits of vaccination with your health professional. With regards to what is in the vaccine, I can confirm that COVID-19 vaccine does not contain any animal products or human matter. It also does not contain a chip that links to surveillance or any other form of information gathering. This is one of the many rumours circulating about the COVID-19 vaccine. These conspiracy theories are false information and are risking lives as they are stopping people from getting the vaccine. If we want a return to the normality of meeting friends and family and going to the Gurdwara, celebrating birthdays or weddings or attending funerals, we need to get rid of the virus. And this is the most effective way to do this. When it is your turn to get the vaccine, please take it. You do not have to do anything or get in touch with your GP. You will be contacted. Thank you. Sat Sri Akal Ji.